During pregnancy and the first few days after birth, your body is producing colostrum. This is a thick, sometimes yellow-coloured milk that is very concentrated, and so your baby only needs very small amounts. Once your baby is born and the placenta is delivered, levels of the hormone progesterone, which is produced by the placenta and stops milk production, drop rapidly. This, along with prolactin, signals an increase in production. Typically, 2 to 3 days after birth, you'll begin to notice the signs of onset of copious milk production, sometimes called milk coming in. Some main signs of this are an increase in breast size, breast tenderness, warmth, discomfort, swelling, and a feeling of fullness or being able to feel your breasts fill. This is because there is a large increase in milk volume, but it won't stay like this. As your body adjusts to what your baby needs, your supply levels will settle down and be less intense. Feed often and responsively and get support if you need it. You can use your normal methods of pain relief, heat or cold, and try to make sure that nothing is too tight on your breast tissues, like underwide bras. A small amount of hand expressing, not with a pump, before a feed may make it easier for your baby to attach in those early days when your breasts may feel very tight or very full. If you are leaking milk, there are a number of options in a range of different materials, from silicone collection shells to bamboo breast pads. This milk coming in can happen a bit more slowly after a difficult birth, for those who have some health conditions like diabetes or metabolic syndromes, for first-timers, or if you have retained placental fragments. If you have unexplained low milk production and are still bleeding heavily or irregularly after you would have expected to have stopped, check with your midwifery team or doctor. Removal of the last fragments of placenta will usually allow milk production to resume normally. Be reassured that the feeling of milk coming in shouldn't continue long term, and if it does, try to look for support with hand expressing or engorgement and get support.